So today I want us to discuss about cesarean section. What exactly is cesarean section? Now, cesarean section is a surgical procedure that normally delivers a baby through an incision done to the mother's abdomen and the uterus, and the baby is moved. Now, this is only done. A cesarean section is a surgical procedure for delivery if the normal delivery or through the normal birth canal is not possible. So if you cannot deliver normally through the normal birth canal, then a cesarean section is done. It's a surgical procedure whereby the abdomen is incised and the uterus is also incised and the baby is removed. That is a cesarean section. Now, there are two types of cesarean section. We have the elective cesarean section and we have the emergency cesarean section. Elective cesarean section is normally done where we already know the reason, the possible complication. We already aware that there is a reason why you should have a cesarean section. An emergency cesarean section is done where we have no idea. We did not anticipate a problem. A problem has just come up, and we have to do a cesarean section because of a complication that has just developed. So we have two types of cesarean sections: elective, which is scheduled, we plan, and then we have an emergency, which is unplanned. What are the possible reasons why you go through a cesarean section? The first one is if you have a previous cesarean delivery, it is possible that we might go through a cesarean section again. The other reason is if you have fetal distress, where the baby is not receiving enough oxygen, or there is complications that are leading to the baby getting distress, you can have a cesarean section done. The other reason where you can have a cesarean section done is when you have obstructed labor, where the baby is not able to come out through the normal birth canal and labor is obstructed. Then it's possible you go through a cesarean section. Positions of the baby can also lead to cesarean sections. For example, if the baby is in breech position, then it is possible, based on assessment, you can go through a cesarean section. If you have placenta issues, whereby maybe a placenta is blocking the route which the baby should go through to normal delivery, you can have a cesarean section. If you have multiple pregnancies, maybe twins or triplets, it can also be a reason for cesarean section. Most importantly, the maternal health of the mother can actually be one of the reasons why you should go through a cesarean section. Let's say you have a condition like preeclampsia, or you have any other maternal condition that requires you to have you cannot go through a normal delivery because of the condition you have. That can actually be a reason for a cesarean section. So as I've said, you have two types. Now, it's very, very important for you to understand that there are benefits, because once you go through a cesarean section, one of the things you have to understand is that, one, it's a safe way of delivery if you cannot deliver normally. Two, it can actually reduce a possible death to the fetus and to the mother. So this is a mode that is selected based on the risk involved with normal delivery. Now, if for example you want a cesarean section done on you, and we do not have a possible reason why you have to go through a cesarean section, I would really advise against that. It is very, very important for you to have a solid reason as to why you should undergo that kind of surgery. Because remember, as long as it's a surgery, there are usually complications that can take place, can come after the surgery. So let's have reasons why we go through a cesarean section. For example, if you have gone through a cesarean section, you can develop an infection. An infection can come through from the incision site, and you realize that either you have oozing discharges, or you're bleeding, or probably there is change of color from the incision site, or it is possible that swelling is taking place and you have some pain. Then if that site is infected, it's very dangerous, because that can also still go and spread further to the peritoneal cavity, and you might develop even a more severe infection, what we call peritonitis. You can actually go further to develop sepsis, which you can go into septic shock, where you find yourself into an ICU, and you can actually lose your life in the process. So it's very, very important also. And even for the healthcare workers, when conducting cesarean sections, hygiene, aseptic procedures are very, very important to observe. Do not actually gamble with that, because maternal sepsis is one of the difficult things to treat or for a mother to come out from. So that's why I advise against going for cesarean section if there is no solid reason for it. Now, at times you might find that going through a cesarean section is much more safer. It will save the baby and it will save the mother. If the baby is in distress, and what is causing the distress actually cannot be resolved, then it is very important for you to go through. You have obstructed labor, then you might lose your baby in the process. You have preeclampsia, an existing condition that can actually be very dangerous if you go through normal delivery. A cesarean section will be good. Now, my guidance to you is that when you are making a decision to go through a cesarean section, it's very, very important to have that discussion into detail. One of the procedures before, let's look at how is it conducted. Number one, the doctor has to inform you. You have to be prepared. You have to know reasons as to why that cesarean section is done. Once you're satisfied with the reasons why the cesarean section is done and the reasons are valid, then you will be prepared. Taken to theater, you'll be given anesthesia. After anesthesia, the baby will actually be brought out after the incision is done. The cord will be separated and the placenta will be delivered. Then the stitching will happen again. After that, you'll be observed for that. Now, why is this important? Is because after that, the baby comes out. This baby needs to be taken care of. So you need to be very, very firm as to how this baby will be taken care of. Do they have a nursery or possible a NICU in case there is complications? So it is usually very important to have these discussions even before going through the surgical procedure, because the outcome of this baby is going to remain with this baby for the rest of the baby's life. So your life will be affected by the effects of how the baby will be handled after surgery for decades. Remember, it is not just delivery. You will deliver, yes, but how is the outcome after delivery? So it's usually very, very important for you when making selections of the hospitals, or when you are deciding which hospital to deliver from, whether they have the capacity to handle you and to handle the baby safely. Make these informed choices when you say. So we're going to discuss more what is it that you're supposed to look at in a hospital in case you're going in for cesarean section. So that is a cesarean section for you. I will not go so much into it, but the next discussion will be on If you have delivered through a cesarean section, can you deliver normal? That is a question that is normally asked by most people, and I'm going to have this discussion with you so that we can see how long should you stay before having a normal delivery after having a previous cesarean section. So be blessed. I will kindly ask you to ensure that you follow these tutorials, learn more and more, follow for more and more, so that you be enlightened. And this channel is mainly for ensuring that you are safe. You are a mother, you are pregnant, you have delivered, or you have just delivered, you have a small baby. This channel is for you, because here is where you're going to learn. I'm going to teach you in a very simple way without having to use complicated language. So be blessed and have a great time.